We have time for one question. So who's first up? Beth up here in the front.
Can't we do better than that?
I really appreciate everything you guys have said, and I can't wait to share this on social media. So seriously, I have a lot of people who went through the Kalamazoo River oil spill and had adverse health effects due to exposure to some of the chemicals that were coming off of the tar sands or diluted bitumen. And over and over again, I kept hearing from all kinds of people that they were kind of being pushed off because they had other health issues that, the at-fault party didn't, they felt like because they had these other health issues, it was exasperating what they were currently experiencing. So this was the overall feeling from a lot of people that experienced that. I would love to know how you feel when hearing that, what kind of response you might give to a community that is going through those feelings and hardships and difficulties when trying to grapple with how to approach it. And my other question is, we also experienced that the at-fault party wanted to pay for a lot of the health expenses that were occurring shortly after the spill, and that created a lot of lack of trust and frustration within the community as to how to handle that situation. And I'm just curious on if you have any thoughts around that piece.
Unfortunately, this is what commonly happens, and it's really difficult for the communities. You can hear it from that excellent presentation here. Let me, since there are so many folks here who are technically oriented, and we've heard about the importance of exposure assessment, let me talk just a bit about the future, which might be helpful, and even in a pipeline spill in a community area, and that's monitors that are being developed that are personal monitors where you give them, I would hope in the near future, you'll be able to give them to the community members so that they themselves can monitor, wear it as wristbands. There are other approaches using fiber. I mean, there's a whole series of technological approach. There's a National Academy meeting coming up in a couple of weeks on just these kind of things, which the response is not, I've got to trust you coming from the state or the city or whatnot to measure these things, or as happened here in New Orleans with the benzene offshore. Well, I'm convinced that that benzene offshore did not get to the public to any great extent because of the measurements on the shoreline and because of the way the wind was blowing, et cetera. But the public isn't convinced, the community isn't convinced. Our data show that the community is clearly suffering from this lack of convincing. What if there was a citizen-based science where they measured it themselves? Wow, that a lot more believable than any of us, unfortunately.